Almost 800 women died every day due to pregnancy and childbirth complications. Hello, my name is Ovi. Welcome to my YouTube channel. Please don't forget to like and subscribe and share so more people can get the information you're about to get right now. So today I'm talking about maternal mortality. If you don't know what maternal mortality is, it has to do with death caused by complications from pregnancy or childbirth. Now, the mind-blowing thing is that Nigeria amounts to 2.4 of the world population, but is accountable for 10% of the global maternal deaths. In 2020, almost 800 women died every day due to pregnancy and childbirth complications. That is 82,000 women in the whole year. That means you can imagine that almost every 2 minutes, one woman died. One woman died because she was pregnant or because she gave birth, or mostly because she did not have access to qualitative health care. She did not have access to the best care, the best education, and the best information a woman can receive in everything relating to childbirth and pregnancy. The United Nations Economic Commission for Africa says that 1 in 7 deaths all over the world happen in Nigeria. More than 50,000 women in Nigeria die every year, and health experts say that 95% of these deaths were completely preventable and avoidable. One thing to note in all of this is that 95% of maternal deaths all over the world happens in low-income or middle-low-income countries, which is proof of the gap between the poor and the rich, inequalities that has to do with access to quality healthcare. Why do these deaths happen? What causes these deaths, you may ask? Women die as a result of complications during childbirth or during pregnancy or even after childbirth. Some of these complications could include bleeding, infection, high blood pressure, complications from delivery, and unsafe abortions. So how do we prevent maternal deaths? How do we help reduce the number of maternal deaths that happen every year or every day all over the world, or especially in Nigeria, but mostly all over the world? Now, for one, unintended pregnancies is a huge issue when we talk about maternal deaths, because we do know that the issue of abortion in Nigeria and in a lot of countries all over the world is that it is illegal. Imagine not having a say over what you can do with your body, not having a say over whether or not you should keep a child or bear a child, because I feel like childbearing or having a child is a very, very serious issue. It's a very, very serious life decision. Forcing someone to actually keep a child when they are not even ready, when they are not able to take care of themselves properly, that should be a violation of human rights. The sexual and reproductive rights of women should be their decision. It should be the decision of the woman, not the decision of the government, not the decision of a man or any other person. Now imagine a world where abortion is illegal and maybe a young girl, an adolescent, happens to get pregnant. An adolescent who does not yet know her way around the world, who does not yet know how to take care of herself. And imagine asking that adolescent to keep the child because apparently abortion is illegal. I don't know if you see it the way I see it, but I feel like that's over the top, because make it make sense. Make it make sense. That's the experience of so many young girls all over Nigeria and in many places all over the world. The fact that they do not have a say over whether or not they should keep a child. Sometimes pregnancy complications may not involve being young or underaged or unprepared. Sometimes pregnancy complications that should result in abortion can be health issues. Perhaps the woman was sick already before she got pregnant. She should have a right to decide whether or not she wants to survive, because that pregnancy can lead to her death. The fact that abortion is illegal is a very huge problem, because so many times these women and adolescents, they opt for other means of abortion which are unsafe. Some of them may include taking herbal drinks that are not actually approved medically. Herbal drinks that could lead to complications in their body systems. The desperation for abortion could lead to going to underqualified and unexperienced, untrained doctors who do not know how to go about it the right way. I feel like to a very large extent, Nigeria is so focused on morality that they forget to educate these young ones on pregnancy prevention. A lot of young girls and young guys out there do not know that there's something called contraceptives, because it is not something that is discussed in school. It should be added to the educational curriculum, if you ask me. The fact that you can actually walk into a pharmacy to get contraceptives. Contraceptions are pregnancy prevention pills. So you take the pills after sex or before sex or throughout the month, so that whenever you have sex, it doesn't, you don't get pregnant. Things like that. The fact that a lot of these young people do not know something like that exists tells of a very major setback in educating young people about sexual and reproductivity, educating young boys and young girls about access to contraceptives, making sure they are cheap and affordable for these young girls and young boys, and actually making abortion legal will definitely make sure that maternal mortality rates come down to a very large extent. Another thing is access to high quality healthcare services, access to high quality healthcare systems. I cannot emphasize this enough. Imagine giving birth in a hospital that does not have qualitative tools and the healthcare workers there are undereducated. I heard of a story recently about a woman who died from bleeding after childbirth because the nurses and the doctors were indifferent about the fact that she was bleeding. Apparently, they kept telling her and her husband that the bleeding will stop and she'll be okay without taking rights or measures to make sure that the bleeding actually stopped and that she would be strong enough and revived. Things like this are things that happen every day, every single day. One woman or more than one woman dies due to things like this that are so simple. It could be as simple as just giving that woman a medication to help her be better, to help her body without making assumptions. It could be as simple as giving medications to a woman who might be infected due to just after giving birth. Medications treat these things, medications cure these things. So why exactly do we have undereducated, underqualified healthcare workers in hospitals? And why are the qualified healthcare workers in hospitals that are not affordable, that are not accessible to those from low middle income households? We need to make sure young girls and women are educated on pregnancy and childbirth. We need to make sure abortion is legal. We need to make sure that women or good quality healthcare services are cheap and accessible and affordable. So, what can you do to help bring this change? You can do that by informing those around you about this major issue, this huge issue Nigeria is facing. You can do that by making sure that the younger ones around you are knowledgeable and informed about pregnancy prevention and every other thing related to pregnancy. You can do that by making sure that women or those around you, pregnant women around you, has access to quality healthcare services. If you're a teacher, tell your students about it. If you are a doctor, make sure you are offering the best quality care and you're getting the best training you can get. And that's basically the little we can do. If you're a writer, write about it. There's so many things that can be done. Though may seem small, but with little steps, little additions from here and there, our voices will be heard. MRHR Collective is a non-profit that is working towards reducing the maternal mortality in Nigeria by 5% in the coming year. By donating, you'll be supporting 5,000 women. Your donations will be used to train the healthcare workers, pay for consistent antenatal care, and pay for quality healthcare services for these women. If you'd like to donate, check the description box below to get a link to their website and their Instagram page for your donations. Thank you very much for watching. Please don't forget to subscribe. Don't forget to like this video. Don't forget to share. And don't forget to make sure you talk about maternal mortality.